Now, one of the best supports a patient with cancer can have is their nurse navigator. This medical professional has clinical expertise and training to guide patients and their caregivers to make informed decisions. Joining me now is Erin Noel, who is a nurse navigator with Baylor Scott & White McClinton Cancer Center. And first of all, how do you help a patient overcome the barriers they might find to their treatment?
But we encounter many different situations. Some of them might be financial, some just might be location and traveling and trying to get here. So we do have a full supportive oncology team that I work with that helps make all that happen.
So yeah, I mean, you mentioned things I hadn't even thought about. Transportation, I'm just thinking, making appointments and making decisions even about treatment. Do you help them in that area as well?
Yes, ma'am. We start from the time of diagnosis and follow them all the way through survivorship. So usually at the time of diagnosis is when they're overwhelmed. They have a lot of questions about their diagnosis, so we help them decipher the medical terminology and come help them with treatment education, planning, and decisions.
So you partner up with this patient and stay with them for the duration, huh?
Absolutely, through all the way through survivorship.
So what does that mean for that patient? I'm sure you've made some fast friends
through
yes. all this.
Absolutely, they become your family, and you become their part of their family. You have a very good bond and a very good relationship with all of your patients.
Well, of course, October is such a great month in that it does bring focus and attention to breast cancer, and many more women will go and get their mammogram because they're reminded of it. Of course, we've talked about the importance of that screening process. Lots of other ways to screen for breast cancer as well. Do you help advise kind of in that area from genetics and all that sort of thing?
Once a patient is actually diagnosed with breast cancer, I do follow up with them. So genetics does play a role in that. So we get them to the genetic testing and the counseling. That also can help with treatment and surgical decisions as well, should a genetic mutation come back positive.
Well, I would imagine in the time you've been serving as an oncology nurse, you've seen a lot of changes in the way breast cancer is even treated.
Absolutely. I've been doing this for about 26 years, and it has changed greatly over the years. There are times where we do chemo up front before surgery. It helps with watching the tumor shrink and being able to make it easier for the surgeon as well when the surgical time does come. Sometimes we still do surgery first and then chemo if needed, radiation if needed, and then if there's any endocrine therapy with pills afterwards if that's needed.
And you also help with counseling or getting that acquired for even the family, the caregivers as well.
Yes, we do. Our family members are there and they're that extra ear, so it's really important. We really encourage them to be involved in the care so they can hear the same thing the patient does. We do have counseling services available for the family members and the patients. We do have some people that come in as couples, so we do have 2 social workers that provide that for them, and it's free.
Oh, well, thank you so much, Erin. There's some information there on the screen, how to get in touch with you all at Baylor Scott & White at the McClinton Cancer Center, and appreciate you being with us today.
Thank you for having me.